Good morning. It's a privilege to open National Pain Week, a time to recognise not just the enormous impact of chronic pain in Australia, but the extraordinary strength of those living with it every day. The Albanese Labor government is committed to supporting people living with chronic pain by implementing a number of important policy measures, like establishing endometriosis and pelvic pain clinics to provide earlier access to care, funding the National Strategic Action Plan for Pain Management, funding the Open Project to equip health professionals with practical, compassionate pain management training, and funding significant research into chronic pain, including $8.6 million in grants for studying novel treatments and management strategies. But this week is about more than policy. It's about people. It's about the mum of young kids, quietly enduring pain to make it through a workday to afford to pay the bills. The young person who's had to put their dreams on hold while waiting for a diagnosis. The older Australian who feels invisible in their suffering. And the countless families making heartbreaking choices, skipping meals, saying no to your child's school excursion, limiting power use just to afford pain relief. Chronic Pain Australia plays an important role in raising awareness and ensuring that lived experience remains at the heart of every conversation. I commend their work and the voices they amplify. This year's National Pain Report, compiled by Chronic Pain Australia, reveals a sobering truth. More than half of those surveyed waited over 2 years for a diagnosis. That delay isn't just frustrating, it's life-altering. Pain doesn't just affect the body, it attaches every part of life: mental health, sleep, relationships, and financial well-being. That's why through Medicare and primary care investments, we're working to build a system that responds earlier, more effectively, and more compassionately. That means more free doctor visits, cheaper medicines, and better access to care, especially in rural and remote communities. As Assistant Minister for Women and Assistant Minister for Indigenous Health, I'm especially mindful of the disproportionate impact chronic pain has on women and First Nations people. Too often they face barriers to timely diagnosis, treatment, and culturally safe care. We must do better, and we will. The fight against chronic pain is an ongoing process. We remain committed as a government to doing everything we can to support those living with it. They deserve nothing less. To every Australian living with chronic pain, your voice matters, your experience matters, and your resilience inspires us to do more. Thank you.